Okay. So the first session we're doing today is providing first aid is the knowledge session. So the learning topic is providing first aid. So what we'll do, we'll give you an overview.
What's happened? Stopped.
No, it's okay. I'm sharing the screen.
Nice.
So yeah, we're going over first aid, which is knowledge of first aid. And what we're going to find out first is, has anyone experienced or been in an emergency before? And if so, how did you handle it? Anyone? Anyone want to put their hand up? Yep.
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 Yes.
What happened to you, Sam?
Yes.
Who's first?
Sam, you can go first. Tell us about your incident.
Oh, yeah. Apparently, I had acute confusion.
Yep.
According to the discharge summary, and I rang someone living in the next room and said, "Oh, can you get me some water?" Which is odd because I've got a fridge. I got water in the fridge, and he immediately called the ambulance. I've got no idea why. And then, because I've got fuck all memory of what happened and how it happened, even well before the ambulance, before the hospital, there's these big blanks of memory. And then they took me to the hospital, and 6 days in the ICU and 2 weeks in hospital altogether. Do you need any more details?
No, that's right. That's pretty scary, isn't it?
Yeah, it was. 3 things were wrong. I had blood poisoning, a liter of water around my heart, and a small
Wow.
heart.
Yeah. Far out.
Full on. Oh.
The 6 days in ICU, they put me on fentanyl because they had to drain the water from your heart.
Yeah.
That was extremely painful.
Feel a lot better now, though. Yeah.
Oh, shit, yeah. Heaps better.
Yeah.
And I had an echocardiogram saying my heart's returned to normal.
What did it say?
I had an echocardiogram that said my heart has returned to normal.
Wow, that's
Wow.
amazing.
Oh.
Yeah, so now all I've got to do is slowly build up the exercise, and eventually I'll start getting normal energy levels.
Yeah. Oh, that's good. Anyone else got anything to share?
Yeah, I do.
Yes. Sure.
Had a car accident when I was 19, and yeah, there was a couple of broken legs, but there was luckily a nurse just across the road from where the accident happened.
Yeah.
And so she was able to, be the first responder and just be calm and take care of the people that are pretty shaken up by the incident.
Yeah.
So yeah, that was great. But yeah, about 10 minutes later, the ambulance turned up, and we're all on. Well, I was certainly in morphine land in a few minutes. It was really nice. Singing Metallica as they're cutting me out of the car.
How fortunate there's a nurse across the road.
Oh, yeah. It's just such a blessing. Yeah. And yeah. So yeah, the next 7 or 8 weeks in rehab, and got home for, I don't know, 2 months later.
Yeah.
Yeah, the rehab was amazing. The nurses and the patients and the understanding. I couldn't walk at all. No, I broke both my tibia and fibula. So yeah, both legs. Yeah, under the clutch and the brake of the car. Little Datsun 120Y. What am I doing in that sort of car? I'm 6'4". But
your Hightower was sitting in the back seat.
That's right. Right on.
All right.
Yeah, that's my story. But yeah, morphine rocks.
Has anyone else? We'll share one more story. Has anyone else got anything else to say about emergency or?
I had nitric acid in my water once.
What was that, Sam?
I had nitric acid in my eye when I was working at a chemical factory.
Right.
But they flushed it out, and I got about a month up there.
You've been through quite a bit, haven't you, Sam?
Yeah, broken kneecap as
Mm.
well.
What did
Oh,
you say when
nice.
the ambulance got there,
Still
Sam?
here, yeah.
Did you say, gee, you're a sight for sore eyes?
I said, "Hi, my name's Sam."
Okay, well, thank you, everyone. So we'll keep moving on. So what we're going to do first is we're going to look at how to assess a casualty. We're going to look at, after we look at this, at the end of, after we've gone through assess a casualty, we're going to look at, we're going to do some knowledge questions, see what you've learned from the session today. And then you'll fill out some feedback forms about the session. So I'll get everyone's email and I'll send that through tonight, just to send it back by Saturday. And yeah, the venue we're on is Zoom, and everyone's in a safe position in their homes. There's no windstorms tonight, which is good. So no one's going to have any trees fall through their homes, so that's good. And so does anyone know, when you're assessing a casualty, what we do first? What is the first step?
Check
the airway.
Check airways.
Check for danger.
Check for danger around the person.
Check for danger, correct. And why do we check for danger?
To make sure that you don't get hurt yourself.
Correct. That's the most important
Probably.
thing. Yeah.
Mhm.
Make sure you yourself are safe before anyone else. Anything else?
Check if they're responsive.
Yes, that comes a little bit later.
Pulse.
Yeah, so in terms of danger, what else can we say about danger?
Is it something to do with, like, if there's anything else around them that might potentially cause any harm?
Yeah, basically whether you're a danger to yourself, others, or the casualty. So you got to look out for things like, you know, electrical wires or aggressive relatives. Remove
Lions.
yourself and a casualty from the area. That's not safe. What did you say? Lions?
Mm.
Yeah, well, if you had the zoo, you never know. Okay, so the next one we'll look at, what's the next letter after D? Do we know?
S.
Ah,
No.
Hey.
that
Who
was
said R?
response.
I said ah.
Okay, R is correct. What does R stand for?
If they're
Response?
responsive.
Response.
Yes, response, correct. So you're going to check for a response. And one way of doing this is you use a method called the COWS method. Has anyone heard of that before?
No. No.
Yeah?
Yeah.
Nope.
No? Never heard of it?
Nope.
No.
COWS
No.
method. So basically, COWS method is a way just to remember what you say to someone. So you'll say, "Can you hear me?" You want to see if they're responsive. You want to see if they could open their eyes. Okay, so then you're going to see, you ask, "What is their name?" If you don't know the person, obviously, and then you're going to say, "Can you squeeze my hand?" That's the COWS method.
Mm.
Okay, what's
Well,
after
they put
R?
S.
S. No one's looking this up on Google, are they? I hope. Instant fail if you do. Okay. S.
What's Google?
Yeah. Do we know what S is?
Send for help.
Send for help, correct. That's right. Send for help if you can. Hopefully there's someone else with you. You can call 000. Do we know what comes after S?
Airways.
Correct. Airways. What do you do with the airway?
You make sure it's clear.
Yeah.
Roll them on the side. Remove any possible, obstruction to breathing.
That's right. Yeah. You roll them on the side if they are conscious. To open up the
If
airway.
they're conscious.
If they're unconscious, you wouldn't want to roll them on their side just yet. That's right.
Mm.
Okay. Airway. What comes after airway?
B.
Pulse?
Pulse.
Breathing.
Breathing. That's right, breathing. So what do we do when we're checking for breathing?
Listen.
Check the rate.
Check
The rate of breathing.
Pulse, I think.
Yes, you want to look, listen, and feel for breathing for up to about 10 seconds.
Yeah.
Okay. So is this something to spell out something now? We probably guess what comes next, can't we?
C.
See?
Which stands for.
Oh, it's CPR.
CPR.
Oh, 3 letters in one.
3
Yeah.
letters in one. Yeah, that's right.
That's impressive.
CPR. So does everyone know? Like this kind of changes. I don't know if anyone's on first aid lately, but it changes every 12 months. It can change. So I did it last year. When I did it, it was 30 and 2 for adults. So
I think that's still the case because I did it this year.
you did it this year? Yeah.
Yeah.
Yeah, for adults, it's still 30 and 2.
What's 30 and 2?
What do you mean?
30
30.
compressions,
30.
2 breaths. Yeah,
Yeah.
2 breaths.
2 breaths. Yeah, we'll
Yeah.
go through that. We'll go through that a little bit later. So
Nice one, Chris.
Have to make sure. Yep.
okay, what comes after C? Do we know? The last one.
D for defibrillator.
That's right. Has anyone ever
Mm.
used a defibrillator before or seen one?
Seen
Yeah.
it.
Seen it?
Yep.
Used one?
Yeah, I've
Used one.
You've used one, yeah? Like for in real life or?
No, just like in a course.
Yeah.
Yeah. Okay. Okay, so yeah. I'll do it. Just hold on 1 sec. Just. Okay. Everyone see it?
No.
Reshare your screen,
No.
Dan.
If you've
Better?
done a primary survey and
You can reshare your screen.
Oh, yeah, sorry.
responsive but breathing normally, they should be placed
How's
into
that?
the recovery position.
Good.
Yeah.
Yeah, perfect.
If you've done a primary survey and established that your casualty is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm across their chest and place the back of the hand against the cheek nearest to you and hold it there. With your other hand, lift the far knee up until the foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help arrives. So remember, if the casualty stops breathing at any time, call 999 or 112 and prepare to give them CPR. And that's how you place someone in the recovery position. If this video has been helpful to you,
Okay, stop that one there. Yeah, so recovery position, it doesn't really matter how big the person is, you should be able to roll them over using that method. Good. Okay, so CPR, it's up to C. If they're unconscious, not breathing, moving, start CPR, 30 compressions, 2 breaths. We'll be doing that in the skill session, which is the next session after the knowledge. And then the defibrillator. So for those who haven't seen a defibrillator before, we'll do that now. I'll just, one sec, resume the. Okay. Okay, can everyone read that, or shall I zoom in a bit? I'll zoom in. How's that?
Yeah,
That's cool.
so much better.
Yeah,
Okay. So we're just going to look at some other things that we may encounter with first aid. So care for bleeding, so applying pressure to the wound. Look, we can't go through this because you need bandages and people to do it, so it's a bit hard to practice this one. But yeah, you apply pressure to the wound, raise and support the injured part. Most people know this. Bandage the wound, check circulation below, severe bleeding persists. Give nothing by mouth and call emergency services, and then obviously care for shock. So remember, assess the casualty. That's always what we have to do first. Follow that process. Doctor A, B, C, D. Doctor F, A, B, C, D. Sorry, it used to be just Doctor A, B, C, and there was doctors A, B, C, and then doctors A, B, C, D. Position casualty. So for shock, keep the casualty lying down if possible. Elevate their legs about 10 or 12 inches, unless you suspect a spinal injury, obviously, maybe if it's a severe car accident or something, and treat any other injuries, okay? Ensure comfort, cover casualty to maintain warmth, provide casualty with fresh air, monitor record breathing and pulse, okay? So there's some examples of shock, so we'll go through that a little bit later, okay? So, oh, what about you? What's going on?
You got to just open the file like on your computer.
Oh, yeah, okay, I'll just do that. Okay. All right, here we go. Okay, so sprains. Can we see this one?
Yep.
Yep. Sprains and strains. So has anyone heard of the RICE?
Yes.
Yeah.
RICE, compress, elevate. Yeah.
Yep.
If you have a nasty.
Oh, yeah. Yep.
Yeah, everyone's probably been through that before. Do not
Recently on the tennis court.
Yeah.
Mm.
No harm, do not do these within the first 3 days. Heat, alcohol, running, exercise, massage. I'm not sure everyone obeys all those rules there, but anyway. Dislocations and fractures. We won't go a lot through that right now. Let's just hang loose for a second. Poisoning. Has anyone ever been poisoned before?
yes,
Yes?
yes.
Poison from what?
It was
Alcohol.
beer that had
Beer?
chemicals in it.
Beer.
Yeah, had cleaning chemicals in it.
Yeah.
Oh, wow. Oh, out of the, oh, gee.
I suppose most people probably experienced food poisoning before, so abdominal pain, drowsiness, nausea, vomiting. But I think everyone's been poisoned by beer before. Yeah, it's quite common.
It was more the Sambuca. The Sambuca really got me. Yeah.
Sambuca. Okay, and we've got burns.
I'm not seeing any
We-
documents.
You're not?
No,
No.
Okay. How about now?
no.
Oh, hang on, let me just.
It's just got all the tabs. Yeah.
Okay, so this is adult CPR. Everyone see this?
Yep.
So as you saw in the video, yeah, tap and shout, yell for help. You hope that someone's with you. Look for no breathing or only gasping. If not breathing, start hands on the CPR, which we'll go through in the skills. So there's adult CPR. Down the bottom there's the DFib. Okay. Okay, child CPR. So with the adult CPR, the hand grip is a little bit different to the child, okay, which we'll go through in the skills session. So check for breathing. If no breathing, start CPR. Push hard and fast around 100 per minute. Okay, so that's the tempo. You want to go at 100 per minute. Tilt head back and give 2 rescue breaths. Repeat sets of 30 and 2. And if you're with someone else, it's good to rotate every 2 minutes because it can get quite tiring. And the last one is the infant. So the infant, a little bit like the child, okay? Push hard and go fast, give 30 compressions. Open airway, give 2 breaths, 30 and 2. Only use 2 fingers though with the infant, not your hand, okay? Okay, so we'll just go through some knowledge questions now. So what we'll do, I'll share this one in the chat and give this quiz a go. Everyone get that in the chat?
Yep.
Yeah.
Okay. Here's your first assessment. Everyone will get at least 100%.
Where's, oh, there's the chat. Okay. Sorry, Dan, I can't, oh yeah, there we go.
Got it? Yep.
Yep. So we just click on that link and go for it?
You click on the link and go for it. Ten questions. Now, some of it you may not know because we didn't cover some of these today. So. So we're just looking at the
What does
skills
it stand
session
for then?
now. So just, yeah, we're recording again. So reviewing the knowledge session. So we've kind of just gone over that. So everyone knows the doctor's ABCD method. Yes, everyone's clear with it?
Yep.
Yep.
Yep. 100%.
Are they unconscious? Are they in shock? Are they bleeding? Good. So what we're going to do with this skill session is all learners will perform CPR for 2 minutes. And the assessment will cover a few different scenarios, okay? So some people can partner up because they're obviously sharing a home together, some can't, so we'll just see what we can do with it. Like, we won't do everyone, but we'll try and do as much as we can. So with these skills, you may save someone's life. Everyone will feel confident after learning this if you ever face a crisis situation, which some of you have. Make sure when you're performing CPR, you're doing so in a safe environment, okay? So what we'll do now, I'll just stop sharing that for a moment. Okay, can everyone see my camera okay?
Yep.
Right. So I'm just going to demonstrate a CPR. So first,
Where's Billy?
First, we're going to do it on adult. And I've got my adult here, okay? My adult, all right? So the adult is here. Okay. So what do? I walk in and I see this adult T-Rex unconscious. So what would you do? You check for danger, yeah?
Yep.
Make sure there's no danger. Check around.
No raptors.
That's right.
Yeah, it's a T-Rex.
It's a T-Rex. What do we do next?
Ask if it's got an itchy nose.
Response?
Check for response.
Response.
That's right. Hello, can you hear me? Hello, T-Rex, can you hear me? Can't hear me. What do we do next?
You say open your eyes.
Send for help.
Send for help.
Cows.
Right. So
Can
send-
you squeeze my hand?
Call 000. Yep, you can use the cows method. That's right. Squeeze my hand. Can you hear me? What do we do after send for help?
Check
for
the airway.
Airways.
Check for response, yes. So squeeze the hand, use the cows method. Then we check the airway. Can we hear any breathing? So we check for temperature. Can't hear it? No? Okay. So no breathing. What do we do next?
CPR.
Start CPR.
Start CPR. So on an adult, I'll be closing my fingers over this way, see? And I'll go with my fingers up this way. You see on the camera?
Yep.
Yep.
Okay, so we're going to find the middle of the chest, the sternum, and we're going to perform CPR like this.
So you have to do 100 of those in a minute, yeah?
Yeah, I'll do 30. And then you can perform 2 breaths. So you just tilt the head. And you can see the chest, if it's making you see the chest lift up and down, okay? And then you can perform another 30 compressions. So as you can see, when I'm doing the compressions, I'm shifting, I'll show you this way. See how, if you're doing this, that's all arm work. The arms will get tired, but look what I'm doing here.
Yep. Full compound.
That's right, hip thrust, lots of strength and power, okay?
No love for ribs.
Yes, that's right. So you see, if you're just using your arms, you will fatigue really quickly, all right? So that's the adult. Okay, so next we have the child. The child is here, okay? A grizzly bear. I suppose a grizzly bear is like a child next to a T-Rex. Okay. So we'll just show you the CPR again. So the child, because they're generally a bit smaller than adult, I'm just going to have one hand. Okay, so I'm going to place my other hand over this hand like this, like that. In the middle of the chest again, and similar sort of thing, just pushing down. Still push with a bit of power. Same thing, tilt the head back. Check. And then continue again. If you get tired, you can stop the other person with you, okay? Okay, we'll do one more.
The baby.
Here we have the infant. Infant is here, okay? So with the infant, because they're so
Doesn't look
small,
well.
we're only going to use 2 fingers on the infant, okay? So it'll be like this.
Wow.
Okay, so infant will just be 2 fingers because they're small. And with the infant, it's only 2 little puffs. Just little puffs, not deep breaths, okay? Because it's a lot smaller, so that's the infant. Okay. Any questions about the demonstration?
No, it's good.
No?
Very good.
So
No, it's good.
Very good.
everyone's going to practice now, okay? Just a quick practice session. So you've got to perform practice on either 2, so an adult or child or
Hey,
adult
Aaron,
infant. Does anyone have
Andy, do you
any,
want to have some CPR done in you?
not on a real human? Does anyone
Why
have
not?
something they can practice on? Why not? a real
All right. You got a teddy anyway?
Anyone got a teddy or something?
You could lay it out here.
You're gonna do it?
No, you do it. Because it'd be cute.
All right, Sean.
Well, Dan.
Yes.
Oh, we've got a cat. Bear will be up to it.
So we're using anything as a.
Anything you can find. Yeah. You don't have a giant T-Rex or a.
Baby Yoda.
I can't find it.
Oh, look, Sean, perfect. Infant,
It's a baby.
perfect.
Yeah.
Yeah.
This is so old, it's never heard of CPR.
Spox.
I've only got one.
So this is a practice. Okay. And away we go now. We've got the timer set for 2 minutes. Let's see how we go. Yeah, pretty good. Just keep the 2 fingers pressed down the whole time, Sean. Like they always stay on there. They don't actually lift off. Yeah, just keep them on there. That's it. Lots of infants. You only doing the child or is it a infant?
It's child.
Child. So keep your arms straight. Keep your arms straight. That's it. That's better. Much better. Get the hip thrust going. Very good. Okay, so that's good. We're doing compressions. Does anyone remember to do the 2 breaths up to 30?
Yes.
Yeah. So think of the rhythm. So it's.
It's a 1.
Oh.
Think of the rhythm.
No.
Count 30.
Staying alive. Staying alive.
Yeah. If you think of a song.
Staying alive.
Count 30 and then you do 2 breaths. Okay, this is the practice run.
Depending on who I ask.
There it is.
What do you do?
Glass of water. In the face.
They're not moving.
Check for danger.
All right. I
Yeah.
thought it would just be someone sleeping.
Follow the process. So what we'll do, we'll get who's
Well, there's no power. Have they had electric shock or something like that?
could have.
Well, that's why the aircon
Stroke,
wasn't working.
Heat exhaustion, could be a lot of things.
Yeah, heat exhaustion.
Okay, so is Will there?
No, Will's computer stuffed up.
Oh, well, okay, that's all right. So what we'll do, Sean, you've got someone else with you at your home, yeah?
Yeah. I just have to
Are
check.
you happy to be get them to be the dummy for a moment?
Yeah, to do what?
They're just going to lie down and you're going to enter the room and just go through
Okay.
the process of what you need to do.
Yep.
So we'll get on your camera. I'll just pause. Not recording. So it's a 45-degree day and Sean has just arrived home and Caroline is just lying there on the ground, not moving. You soon realize there's no power. What do you do? Sean, what do you think you do first?
Put the phone.
Yep.
Can you still see?
We can see. That's good. Very good.
Yep. Okay. What do I do? I would
think back to the knowledge session. What do you do first?
Check for dangers around.
Correct. Very good.
Check for dangers. Nope, nothing's dangerous. Response. So shake the shoulders a little bit.
And I'm going to tell you that she's not responding.
Oh, she's not responding.
She's not
okay.
responding. So what do you
no
do?
response. Well, you send for help.
Yes. So just so there's someone else in the room with you, and you ask them to go get help.
Get onto the ambulance, Amby. Yep. 000, please. And So yeah, now airways.
Airways.
So
Check the
listen.
airway. That's right. Check for
Can't
breathing.
feel, can't hear anything.
Check for 10 seconds. Check for
Still
10
out.
seconds. Still no breathing. Okay, so
Still no breathing. So now we do the CPR. Or we
yes, so
CPR.
begin because there's no breathing, because there's been no response, you begin
So
CPR.
we lie them flat.
So you don't have to do CPR on Caroline. You can just grab your. This is part of the assessment now. So grab your
My doll.
grab your doll and
Yeah.
pretend it's an adult CPR. So let's see your grip.
Okay.
Do you remember what your grip is?
Well, I can totally just
Show us your grip for the adult CPR.
right
Yeah.
here.
Correct. That's right. Yeah.
Yep.
Perfect.
Yeah.
And let's go. So we have 30 compressions.
Yep.
Away we go.
I won't break the doll.
Arm straight, hip thrust. Very good. Yep. So remember when you breathe, you check, you listen.
Oh yeah.
Go again. Yeah, that's right. Yeah, that's
Yep,
right.
yep.
Yeah, 2 breaths. Good. And be another 30 compressions. Where we go. That's it. Power.
It's good.
Thanks for joining in, Caroline.
That's all right. So you
Thanks,
do
Caroline.
need to check the pulse.
Yeah,
And
pulse.
if there's,
Pulse
so
check.
if there's still no response, then obviously Caroline's already called for help, or she can get the defibrillator if you have one. Like it depends where it is. So
Yeah.
that's really good, Sean.
But
Very good.
when does the pulse check happen? That's when there's a response.
That's before
But
you
yeah, you
do
get a
the-
response. Yeah, that's right. You get a response. Okay, so next scenario. Here we go.
Glad you found your goal.
Mm. You've just been involved in a car accident.
To the front.
You were the front seat
Passenger
passenger.
at the driver's off the road, avoiding passing Wombat. You hit a tree. Everyone seems the case. If you notice the driver's shoulder looks to be out of its socket. They begin breathing rapidly, and the skin starts. to
You're
pale.
the.
They
They
then
got
now they
shot.
can lie down. What do you do? Yes, so that's what we we're talking about earlier in the knowledge session, that they
In
are
shock.
in shock. So we're going to play out this scenario now. Okay. So think about what you might do. So who's the person who's in shock?
Matt.
Matt's in shock.
No, me. No, I'm in shock.
Okay.
You're in shock. You better set up the camera.
Yeah. So yeah, so you'll be, so it says you're lying down and you've turned pale, and you're obviously in shock because you see your shoulders dislocated. That's caused you to go into shock.
You low or lean up there or something, I suppose.
Yeah. So basically, Matt, your job is to come in and how you assess the casualty.
So she's shaking. So I'm checking for danger.
That's right. You remembered? Very good.
Right. So the car's okay and everything.
Yeah.
And then response, but her response is that she's conscious, but she's shaking. So
That's right. So you don't have to start CPR.
and she's yeah, exactly.
That's right. That's right.
Send.
Send for help. So is there someone else here I can?
Yeah. So there might
Send
be
for help.
someone else is in the car, so you can send them off for help. Definitely. Yep.
Yep. Okay.
So how do you?
You're in shock.
So how do you keep her calm? What do you do?
Oh yeah, that was talking to her.
Yeah.
You know, taking her, sort of looking after her, calming her down,
Yeah.
that sort of thing.
That's right.
Was what else?
Is this the one where you asked the name and the?
Oh yeah, you asked their name. There was an acronym for it.
Cows, yeah, that's if you don't know them, yeah.
Yeah.
Oh, okay.
That's if you don't know them. This doesn't say whether you do know them, but that's part of the checking for response.
Okay.
So one thing you could do with shock is position the casualty, is elevate their legs about 10 or
Elevate the
12
legs,
inches. Elevate their
Right,
legs.
okay.
You have a line the other way. That'll help her feel better.
Okay.
And what other things could you do to ensure her comfort? If someone's in shock,
Yeah, legs elevated.
yeah, it's a common thing that happens at the gym is people can feel dizzy and you elevate their legs. They feel better pretty quickly, so feel a bit lightheaded. That's, yeah, so you're saying
Right.
shock. What other things can you do to ensure comfort?
Well, if her
You
shoulder's
want-
dislocated, don't move her
Yeah.
shoulder.
Yeah, I was just going to say you wouldn't put him in that position that you had before.
Keep them warm.
Where you turn him
Yeah,
over.
keep them warm. That was one. I remember
Yeah,
that.
that's very important. Keep them warm. Yeah, very good. So you could use like a blanket or
Yeah.
jacket or something from the car. Yep, that's right.
Yeah. Okay.
Okay, very good. That's excellent.
All right.